Well, it's 7 o'clock. Why don't I start then? So I'm going to start the meeting by reading the protocol of the Zoom meeting. I'll be really glad sometime next year not to be reading this to you all, but here goes. In accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting this evening, November 17th, 2020, on the Zoom platform and in accordance with the town's policy, directive, and guidelines issued on April 1st, 2020, as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. And this meeting is being recorded and will be available for later viewing on the town website. All committee votes will be taken via roll call, and we'll start with an attendance roll call. For members of the public, please unmute yourself when I'm open the meeting to the public comment. So, Alma Healy.
Present.
Present. Jill Block. Jill.
Present, sorry.
Okay, Mark Haddad.
Present.
Ray Considine.
I don't see Ray here yet.
I see him. He's right there.
Right here.
Oh, do you? Oh, hi, Ray.
Hello, Susan.
Susan Rask is present. I see Karen Byrne is present. And who do we have as guests this evening?
You have Gordon Bemis from Hutchins Farm.
Oh, hello, sir.
And I have two managers with me, Eliza Bemis and Brian Kramer, who manage the operation.
Great. Well, thank you for being here. The first item of business does pertain to you. It is a variance on a well regulation. There was a lot of documentation that Karen kindly forwarded to all of us, including schematics and plot plans. But I will ask probably Susan if you could give us a sort of summary of the issue.
Sure. So Mr. Bemis got in touch with me about a month ago. As you'll see in the letter that he submitted dated November 2nd, the river water that they use to irrigate the crops does not meet the new Food Safety Modernization Act bacterial standards. So they're in kind of a pickle, and to fix that, they want to drill a well, which of course would reduce the bacterial counts in the water. And so I think that's a great idea because we certainly want food crops irrigated with clean water. So the only place they have to do that apparently is down in the floodplain area. You might know that their land slopes down to the river. They've been taking water out of the river to irrigate the crops. So the best place to put the well is within the 100-foot floodplain. Your private well regulation prohibits installation of wells in the 100-year floodplain, mostly out of concern, I think, for flooding, that surface water could infiltrate the well and contaminate it. And the way they propose to get around that or compensate for that is to put the casing of the well 2 feet above the flood stage. So that's what all the pictures and diagrams that they submitted were about.
Okay. All right. And the water from the well or from the sampling has been tested and does meet these organic standards?
No, we actually, the well driver, we've only done a test well, and he doesn't recommend actually taking a test then, because there's too many contaminants from the test equipment that can vary the results. So we don't know for sure, but we'll be testing as we put in the permanent well. Yes.
So you could drill the well and then find out it's
possible that could happen. I assume we don't have to go that far below. We're not looking for drinking water standard. It's basically swimming pool standard. It's sort of an arbitrary standard that they've established, and there is some dispute about where that will go. But we seem really reasonably sure that we can meet the standard by drilling a well. The well driller we're using has done many irrigation wells, Frank Sullivan, and as well as many municipal wells in gravel like this. So we feel pretty sure we can get.
And
Good question.
sand and gravel are great filters for bacteria. I'm guessing that the water will come up really clean.
Okay. Do board members have any comments or concerns or questions for Mr. Bemis or his managers?
I have a question. Just looking at the schematic here, there's a 25-foot pipe between the existing grade and I assume, is that the bottom of the well, or what does that indicate?
Yes, the test well we drilled was down 23, we hit refusal at 23 feet. It was a 2.5-inch pipe test well, and it yielded 78 gallons per minute, which was a phenomenal rate for that kind of well. So they basically hit what we thought was bedrock at that point.
Okay.
We carefully sited the well as best we could using geosurvey information to get into that gravel that's along the river, but still keep from going too close to the river. So we were very lucky. We did a couple other tests just outside of the floodplain, and they couldn't go down more than 10 feet. So we didn't get anything out of those.
Thank you.
Thank you.
Other comments or concerns from board members?
I'd like to make one. In my letter, I indicated we were going to drill a 6-inch well. If you do approve us, I don't want you to hold us to 6 inches. We are working with an engineer from the USDA Natural Resource Conservation Service in designing our system. And so we haven't actually sized the exact size that we may need. It could get a little bigger, so I don't want to be restricted if you can do that.
Yeah, I mean, I think the issue here tonight is really the location. So that seems to be a technicality.
Thank you.
Susan, what's the recommendation from you?
My recommendation is that you grant the variance. So it's an actual variance to your well regulation. So it's a variance to Concord Board of Health Regulations 7.00 minimum sanitation standards for private and semi-public water supplies, section 7.05C, table 1, to construct an irrigation well within the 100-year floodplain. And my recommendation is that the variance be approved.
Okay. Any further discussion before we vote? Do I have a motion to approve the well variance?
I move to approve the well variance as Susan stated.
You don't want to repeat that whole
I
regulation?
don't want to repeat it.
Do I have a second?
Second.
Okay, so we'll take a vote. I vote in favor. Alma, in favor. Ray
Yes.
and Mark
Yes.
and Jill.
Yes.
Great. We all vote in favor. Well, good luck with everything, Mr. Bemis. We will look forward to your farm being continuing in the future. So
Great. Thank you all very much.
you're welcome.
Thank you, Susan.
you. Yep, thank you.
It's a beautiful property, that farm. So
It is.
Yep. And they're good stewards of the land. So
Yeah.
you know,
yeah,
Mhm.
great.
this is the right thing to do.
Yeah, absolutely. All right. Well, moving on to more somber topics, COVID-19. Susan, what do you want to summarize the recent mandates from the governor and DPH for us?
Yeah. The news on the biweekly calls from DPH is sobering. Everybody is acknowledging the rise in cases and the stress it's putting on everybody. I think the healthcare system's getting exhausted, the public health system's getting exhausted. And we're going, it's not going in a good direction. And I'm sure Governor Baker is under a lot of pressure to keep the economy open and keep the state open. We can't go into another 8-week shutdown, I don't think. So to try to work with that, he issued on November 6th a number of orders. One is the order requiring face coverings in public places. So anyone over the age of 5 years is required to wear a mask or cloth face covering when in a public location, indoors or outdoors. And it does specify what's a public location. It's probably not everywhere, but it's a lot of places, and that's good. And then he issued the early closing order, which means that most businesses have to close at 9:30. Because he issued the stay-at-home advisory that everyone should be home from 10 p.m. to 5 a.m. It's just an advisory. He can't enforce it, but that's what he's asking us all to do. So I think acknowledging that Thanksgiving is coming and people are getting together, and college kids, many are coming home and are going to want to kind of go out and party with their friends. He's just decided that restaurants are going to close at 9:30. A lot of businesses are going to close. Alcohol can't be served after 9:30 at restaurants. Restaurants can stay open for takeout, but not for seated dining. And it applies to a number of other businesses too. So I'm hoping that will help. And then he's further regulating gatherings. The number of people that can be at a private home is now 10 indoors and 25 outdoors, I believe. And let's see. And all those gatherings have to end by 9:30 except for religious gatherings. Indoor gatherings at event venues are limited to 25. 100 people for an outdoor gathering. We're in a lower risk community, but I think the big one is the 10 people indoors at private residences. And for people that exceed it, it's $500 ticket for every violation, and every person over 10 is a violation. So not that we really want to write people tickets, but he's serious about it.
Yeah.
So, but the case numbers are up. Friday, we had 2,400 new cases diagnosed that day,
Yeah.
versus 600 new cases in early October and like 250 in July. So it's not good. We're going right back to where we were in the spring.
Yeah. Yeah. And I agree with you. I think, public health is exhausted, hospitals and staff are exhausted. And, I think we'll see what's happening across the country around here where we don't have enough staff to care for patients in hospitals. So
it's getting scary. So I will tell you that right now we have 9 active cases in town because we got 3 or 4 more over the weekend. So we now have 3 in Concord Public Schools, 1 at Concord Children's Center, and 1 at Fenn. So that's we've been having 1 or 2 school cases a week, but this week we've got 5. I don't take that as a good sign. We've never really had 9 active total cases in a week. It's always been around 4 or 5. So maybe this is just a bad week. And then MCI Concord is having a big outbreak with 90 inmates and 16 staff. Apparently they weren't paying attention to PPE.
told you.
Is
Is there any sense of why the students are getting infected? Is it sports? Is it family travels? Do we have any sort of idea of cause?
So DPH in their weekly COVID report actually puts out the cluster analysis, and I will forward that slide to all of you. I don't have it right here because I'm on my iPad. Households are like the major cause of spread, but that's not unexpected. People live together, they're going to infect each other. Social gatherings are significant. Of course, long-term care, congregate settings, all are big sources. The good news, I think, is that there have been 43 clusters in public schools, but only 87 positives that came out of those 43 clusters. So that's really only 2 people per cluster, sort of. So the good news is, we still aren't seeing community spread in the schools. We're still seeing isolated cases. So I'm good with that. But as for sports, they closed hockey rinks for 2 weeks. Those are open again. We're still seeing cases on hockey teams. We're seeing cases we have 2 cases on a girls' soccer team this week. I think your son, Deb, his basketball team had an exposure, right?
Yep.
So, I'm not saying there's no risk associated with sports, you're bringing groups of kids together.
It's a huge risk. Yeah,
Yep.
I think. But at least from my son's experience, wearing masks all the time during the practice seems to have, he says he wasn't that close to it, but, seems to have worked. So
Right.
I don't know.
And Governor Baker is really pushing to get kids back in school full time, which to bring the middle and high school kids back means we would not be able to keep 6-foot distance between kids. Because right now they've only got half the kids in the building at any one time. And Lori Hunter does not really feel good about that.
About which, not having them all there or bringing them all together?
Bringing them with less than 6-foot separation. I mean, we all would like kids back in school, right? We all recognize the value of that, but.
Yeah. Do you think there's any interest in getting testing done in the schools on a regular basis now? If we bring all students back every day, do you think the school board would reconsider?
We haven't gotten to that point in the discussion. We just sort of know what Governor Baker is saying publicly, and it's kind of, how far is he going to push that? We don't know. But I almost think you'd have to,
Yeah. Yeah, I do. Yeah. Okay. Is there anything else you think the Board of Health should be doing to help?
No, I'm trying to find Tricia some help. She's pretty maxed out. She's, nine cases in Concord and plus whatever she's dealing with in Carlisle and Lincoln can be overwhelming. So we're trying to figure out who we can get to help her.
Okay.
I don't think she's getting as much support from Emerson Home Care as she might need to be getting. I don't think they quite understand. They know they're paying her for overtime, but I don't think they understand that she's working nights and weekends all the time.
Yeah, I mean, she told me she gets up at 4 a.m. and starts checking results. I mean, that's
right.
Yeah.
And at 8 o'clock at night, if Lori Hunter says, I just had a call from a parent with a positive kid, then she starts in on trying to, well, maybe that would wait till the morning. But I mean, as soon as she can get on it, she and Lisa Koski at the high school get on who they've got to contact, and they do it as quickly as they can. So it's kind of nonstop. If she gets the notifications over the weekend, she's working on the weekend.
So you need a nurse to do that, to help her.
It would be best, yeah.
Okay.
It would be best to have a nurse. I mean, you can train someone else to do it, but I feel like she does so much hand holding and the parents are scared and they kind of want to talk to a nurse, and you know how it goes.
Okay. All right. Let me think on that.
Okay, thank you. Thank you. Any ideas you have would be great.
Yeah, I could think of 1 or 2 people that might be interested. So all
The
right.
town's got money to pay them for from the CARES Act, at least through December. So money is not an issue.
Okay.
And somebody like Janet Lipkin comes to mind. She, I don't know if she's working full-time with the Sudbury COA, but she's a nurse and she is such a compassionate person.
Yeah, she'd be awesome.
Be awesome.
And Louisa Poster is working for Community Tracing Collaborative.
Oh, really?
Yeah.
Oh.
Yeah,
Good
she got
for her.
hired. Yeah.
I heard that. That's great.
She's nice too.
Yeah.
So the logistics around all of that would mean they'd have to be employed by the town and go through all that approval So it's not that simple to move a nurse from one location to another unless they're already working for that particular, either it be Emerson or the town.
So we could write a contract with an individual, or we already have the contract with Emerson Home Care. So if they were already working for Emerson, maybe they could just be added to that contract. I don't know.
Yeah, that's what I'm thinking, is an Emerson person.
So going to Chris Schuster and asking her might be the way to go.
Yeah, I might have one or two individuals I can ask first to see if they're interested, and then if that doesn't pan out, we can broaden the search maybe.
That would be really helpful, Deb. I hate to put it on you, but you're like the lady with the connections, you know?
Yeah.
And so are you, Alma. Maybe you know,
I'll be thinking if there is somebody available.
yeah.
Mm. Okay.
I just fear it's going to get worse before it gets better.
Yeah, I think it will. Definitely.
That way.
So, all right. Well, we could move on to item agenda number 4 about Concord bikes and biking to school. That's a happy topic. And so we were going to review information. What were we going to do with this tonight? We're going to vote to sign a letter. Was that what I thought?
I
No.
think you were just being asked to be a partner in the Mass Safe Routes to School Alliance.
Mm-hmm.
What
I'm
you
not
said.
really sure what that commits you to.
You know, I looked it over. It's not a heavy lift. It's basically that we're a resource. We're willing to share information, help promote their, participation, guide them on children's health, the benefits of, activity. It's all of that work that health departments can easily do.
Yeah.
So it was something that was studied and talked about in the Healthy Concord process. I don't see a reason why we wouldn't sign off on it.
Yeah,
Great.
seems good to
I don't
me.
understand what we're signing on though.
There was like a form. I mean, there was like basically this agreement. It looked like
It
that.
was an alliance application.
I think it's for their application to be an official participant, and I don't think they're getting any money from them yet, but to be qualified perhaps to get funding.
Yeah.
Having the affiliation of the board of the local public health department is what they need to show,
Okay.
a little bit of
Great.
information.
Okay.
How many other health departments have signed on to this?
This is a national project. I mean, it's all over the country, I'm sure.
No, I mean in Massachusetts.
I don't know. I don't know. I know that Bedford, though, is. And so, in the materials they sent us, it even features the, Bedford folks, including their Healthy Concord, or their Healthy Bedford program staff who did the same project at the same time we did. And they carried forward. So they're very active with it. Active enough to be in the promotional materials. So,
Yeah, they put a lot of their Healthy Bedford funding towards improving walking and biking and transportation. They've taken that a long way.
right. That was the number one thing that came out of their assessment. Transportation was it, and multimodal, because they were looking at regional buses as well as walking and safe routes to school. So they went.
Yeah. At our last meeting, I think, Jill, you may have mentioned something about the Fenton report talked about safety issues. What have we done about those safety issues? Has there been anything?
So my neighborhood in particular has been really active in this. And so Garfield Road, and so picture Sudbury Road where Garfield and 7 Star Lane hit. It's all the access to the Willard School. And, we've been trying to get a crosswalk there for years. And so this has been part of, the long range plans and CPW work. There has been delays on it, but just in the past few weeks, they put the radar speed trackers up from both directions because it goes from, it's a fast road, 35 miles, it goes down to 30. They've put those up. And then yesterday I actually saw 2 police cars watching traffic in both directions for this corner. So in the absence of being able to put in a permanent solution, they've certainly been trying to train the regular commuters during the early morning school commute. That's, you know, for now. I think that there's been challenges in doing more safety work and training around it. They've tried. The police, my neighborhood also wanted to have local parents acting as crossing guards. The police did not want them to do that. So there's a lot of work to be done around safety.
Wow.
Yeah.
I'm surprised. They can't even put in a crosswalk?
There's a lot more to it than that. You know, I mean, Jane might know as well, but yeah, it's not been easy. We have, you know, a lot of people advocating for it. This is a pretty active neighborhood. So what do you know, Jane?
I was just going to say, I'm happy to weigh in on all the different points being raised in terms of the Concord Bikes and Bike to School effort. First off, I don't know whether anybody's been following, but our MBTA ridership is in the process of being cut because the MBTA ridership is down so far. So from a sustainability and our green communities and all of our climate efforts, places that we really can make a difference, like local bicycling access, are going to be more and more important, at least in the near term. I mean, I don't know what our public transportation is going to look like in the future, but it's a place that we can all focus on right now. And I think that just makes the opportunity that's presented here even more important, to the point that Jill brought up in terms of the intersection at Sudbury Road and Oxbow and Garfield. It's a known problem. It's under discussion at the Transportation Committee, which and it's been, the centerpiece discussion of the first 3 meetings of that committee. I hope that we do move on to bigger issues in Concord on transportation. Just to put in my own thought process, because all of Concord needs a lot of addressing in terms of not just bicycle safety or pedestrian safety, but the ways that we can tie transportation to other policies we're promoting in town. I do think that there's more. I mean, it's not that the police wouldn't agree with public health and public safety. So I don't think it's quite that. It was really a debate over what the town engineering department saw as the right steps, what the citizens really needed and wanted, and residents, especially because many of them in the expectation of using this pathway to get to school had opted out of the buses. So, I mean, it's one of those perfect storm places. I think the town is doing its best to accommodate the needs without putting something in place that at this point, the town engineer is not signed off on as the right approach. So we have the police officers there. We have the speed, it's step by step by step. I'm not going to go out and say that we've got it right yet, but it's as much as could be approached in the time frame that was brought up. It would have been great if options, if these things had been spaced out a little differently, and so that, for instance, parents that might have chosen not to opt out of buses wouldn't have opted out. That being said, I still think it's great that this number of kids and parents are using feet and pedals to get to school. So I fully encourage the board to sign on to this effort. I don't see any downside.
Yeah, I agree. I think, like Jill said, it's not a heavy lift for a lot of goodwill, and we'll hopefully get some benefit for the town out of it. So
Great.
I'm sorry to be dense, but what are we doing though? Does this paper that needs to be filled out, is that they're gonna fill it out or the board's gonna fill it out?
My understanding was they fill it out and then we just sign on that we're.
Sign
part-
off? Okay.
I think we just have to affirm that we're, supportive. of it.
Behind them? Okay.
It's like a letter of support. It's, yeah, but they do the work. We don't do it.
Okay.
Okay, I just was confused, that's all, sorry.
Great. All right, do we want to talk about the board calendar
Well,
next?
do we need a motion though to
Oh, sorry. Okay.
do this or?
Yeah, we should take a vote to support them.
Okay.
Sign on as an alliance member, right?
Okay. Do I need a motion then? Okay. Do I have a motion to sign on to the alliance, to be an alliance member of the Massachusetts Department of Transportation Safe Routes to School program?
So moved.
All right. Do I have a second?
A second.
All right. So Ray, your vote is
Yes.
affirmative. Jill.
Yes.
All right. Alma,
Yes.
Mark.
Yes.
All right. I vote yes as well. Okay.
Thank you.
All right. Now we can go on to the board calendar and minutes. Our last meeting of 2020 is December 15th. And then Karen, you provided us with the 2021 meeting calendar, which I haven't gone through and checked dates yet, but with my own calendar, but I will and get back to you. Does anyone have conflicts they know of that we can look into other dates tonight?
Right now.
Okay.
I didn't switch out April vacation or February vacation, only because I just put the dates that we normally would meet. And then we're gonna be on, we might be on Zoom in February, I don't know.
Yeah.
So I just put them all on there.
You can Zoom from vacation, right?
Yeah.
Never get a break.
Yeah, right. Okay, and then the minutes. Did everyone get a chance to look at the minutes for September and October? Are there any edits for Karen?
Ray and Mark both sent me their edits and they were similar. And I incorporated them into the,
Okay.
I don't know if anyone else had any.
I didn't find any others.
All right, moving on to board and member reports.
Wait a minute, you have to vote on the minutes.
Oh, God, sorry.
Okay.
All right, can we vote on both of them at the same time, or does it have to be each individual?
It'd be better if it was individually.
Okay.
I'd like it better.
Okay. Do I have a motion to approve the September minutes?
So moved.
And do I have a second?
A second.
All right. And Alma, how do you vote then?
Pass.
Ray,
I vote in favor.
Jill,
Approved.
Mark,
Approve.
and I vote yes as well.
Yep.
Our minutes are approved. Do I have a motion to approve the October 2020 minutes?
So moved.
Do I have a second?
Second.
All right. And Alma, how do you vote?
I approve.
Ray,
I approve.
Jill,
I approve.
Mark,
I approve.
I approve as well. So the October minutes are approved as well.
Thank
All right.
you.
Now we will go on to board member reports. I don't really have anything other than the state of COVID.
Not really.
A quick update on open tables operations in Concord. I don't know the actual details, but the distribution at the high school, I think the last one was probably this week for the month, but we are going to be doing a drive-through distribution out of First Parish Church.
Okay.
I'm not sure when it's going to start up again, probably right after the holiday, or sometime in December, but that's the new location for winter operations in Concord, probably twice a month. So we're really excited about that.
Mhm.
Guys are doing such a good job, Jill.
Oh, thank you.
That's great.
Yeah, it's tricky. Winter's really scary. Just wondering how we're gonna do it. Like, I think last I heard we were looking into getting like an ice fishing hut to put in the parking lot in the Maynard location to use that as like for
Wow.
and drive up, place their orders and drive through. We're also hoping to do online ordering, but system is still being developed. But it's really tricky and demand is definitely going up for food. Next week we're distributing, I think it's like 450 Thanksgiving meals. In the past we would do grocery bags, turkeys. It's too complicated and we're instead doing meals. So I'm going in personally and baking about 200 things on Saturday to go out with.
Wow.
Wow.
It's fun. That
Impressive.
part's fun. So, but anyway, it's definitely busy, but please, as people hear about need or spread the word that we're still operating, still getting food out to people.
Good. It's important work.
Yep.
It's impressive too in Maynard, Jill. I've seen it.
Yeah.
It's impressive.
Thank you. Yeah, no, it's amazing. It's great to see. I mean, we worry about the staff. I worry about the staff all the time. And, we're starting to put different, I think a little bit more, not distance, but making sure that there's very clear shifts in staffing and, groups and just trying to keep an eye on the people who are working really hard.
Yeah.
Nice.
Okay.
Deb, just a quick update. We, at our last meeting, we voted to support the SAFE bill that would direct more money to local public health. And good news is that last Thursday, the Joint Committee on Public Health voted the SAFE bill favorably out of committee. And so that's moving forward. Eventually it'll come up for a vote in the House, who knows when, and then the Senate on their side, they actually voted to support $10 million in grants for local and regional public health departments.
Wow.
And so that's big. That would have to go to conference committee. So, knowing what the House might do. But I thought that was a really a big step. And then they also, it's a joint committee, of course, so that the Senate also supported the SAFE bill, and the Senate tagged on about $1.7 million to the bill, and it'll go into conference committee as well. So I think all that's good news going forward. So hopefully it'll have some. We'll see some results here in town.
Nice.
Be really nice to see public health be supported.
Yeah. Yes.
Yeah, definitely.
It's nice since the tobacco money all went away, right?
Well, the good news on the tobacco front is the governor level funded the state's tobacco program, and then the House put in $500,000 more. So that's also, given the strain and stresses on the state budget this year, I thought that was another really big win for public health.
Yeah.
Yep, that's great.
Yep.
Are you going to be listening in on the, is it this Thursday, the tobacco-free mass?
Yep.
Okay.
Yeah.
I have a conflict, so.
That's Tobacco-Free Masses fall conference, and it's going to focus on the menthol efforts. So, I'm going to sit in on that. I don't know the exact times.
Yeah, I thought was it 3 o'clock?
3 to 4:30, I think it is.
Yeah.
Yep.
All right. Well, you can fill us in next month on that. Be good.
Susan, thank you for forwarding that email from the tobacco control person, the new woman.
Yeah. Erin Murphy. Yeah.
Thank you for sending us that.
I hadn't heard a whole lot from her, but I think she's just kind of quietly getting into getting the job done.
Mm-hmm.
Yeah, it sounds like it's a lot of, just getting in there and going over a lot of details with places. So
yeah, laying the groundwork and really getting them up to speed on the new requirements. So,
Yeah, well, that's
Yeah.
good. It was good to get an update. Thank you.
Yep.
All right. Anyone else?
No.
Staff reports?
I think I've said everything I have to say. You've heard everything that's in my brain.
Thank you. Well, thank you for doing what you do. It's very important for
Absolutely.
us.
We're all just gonna get through this. We're gonna get through it.
We are. The vaccines are coming, right?
Yeah, and I'm actually gonna try to convene a meeting after Thanksgiving with like the fire chief and the town manager and sort of like start to think about what the vaccine clinics are gonna look like. We don't have a lot of guidance from DPH yet, but it's time to start looking at it from the 10,000-foot overview of how we're
Okay.
gonna do it.
All right. Let me know if I can help.
Thank
Think
you.
about Yeah.
Thanks.
Susan, along those lines, I mean, what's the status of the Medical Reserve Corps in town these days?
So it's a small group of maybe 12 people. You know, I don't know any of them well, and I don't know their skill sets. Many of them are nurses, but you need many more people other than nurses. I mean, we certainly can't vaccinate 12,000 people twice with a 12 or 15 member medical reserve corps.
Right.
So I don't know where we're going to get the medical and the non-medical staff.
Yeah.
And that's a conversation I have to have with the town manager. Can we put out a call to town residents who are medical professionals, nurses and doctors? Is the town willing to have volunteers work at the clinics, whether they're credentialed as MRC volunteers or not? And how do we find volunteers that are the non-medical people that just kind of push people through the clinic and do all the logistics and keep it all running? So it seems like DPH is, from what I know, there are typical medical offices that already are vaccine providers like pediatricians and stuff like that. It seems like DPH is trying to get more and more medical offices on the MIIS so that they can become vaccine depots. It seems like they're going to try to have as many physicians do immunizations as possible, and the pharmacy chains. At least for the first couple of waves of vaccine, which will go out to healthcare workers and then probably essential workers and then probably people over 65. And it'll be a while till we get to the general population, but those clinics are going to be huge. And
Yeah.
So my next question to DPH is, how are we going to, so we have a regional medical reserve corps in 4A and 4B. Are those volunteers going to be shared amongst towns? And, what is the state going to commit to doing?
Yeah.
If I could ask a question. I just saw it was in the Concord patch, God help us, but when that's where I get my news, but that Stop and Shop has now announced that they're going to be offering, I mean, it's interesting that there's a marketing arm that's already starting in advance of both the vaccine and perhaps the trained professionals.
Yeah.
So pharmacists can administer vaccine, and that is probably 10 years, 10 years old kind of thing. So Stop and Shop has many pharmacies, and if they want to get into the game, that's great. We had Walgreens do our employee flu clinic this year, and CVS did the flu clinics in the schools. I think they did 2 or 3 of them, since the school kids also all have to get flu vaccine this year. So I think the commercial pharmacies want to be part of it, and I think that's great.
I think there's just a difference. There's some confusion because not every Stop and Shop, not every market has the capacity. And yet to the untrained eye, it looks like Stop and Shop, go and get your tomatoes and, your cereal, stop by and get a vaccine. Not those of us that have pharmacies associated with our facility will be in front line offering free vaccines.
I mean, I think CVS has been saying that, and Walmart have been saying that they'll give people flu vaccines for years and years. I think that's part of what they market. So if Stop and Shop is getting in the game, that I'm not surprised. I think there'll be more commercial, ventures, but if that helps take the load off public health, then you know what, it's okay. It's
I
not
think I
like,
was bringing it up more as a, you may get more questions because there may be more and more confusion as this mounts. Not that I have any disagreement with or any business having an opinion on, which trained entities are giving out vaccines. But, when the headlines are going out at this stage, it gets, especially as we're ramping up and people are getting both fatigued and nervous. I suspect Susan and Karen and your team are going to hear more people.
Yep, I imagine we are. But I don't think the general public, I don't think we'll have vaccine for the general public until maybe April, May. I don't think it's gonna, I think healthcare workers might start seeing it in January or February. I don't know. What are you ladies hearing?
I would think, yes, for
Mhm.
frontline workers, yeah, around the winter. But I wouldn't expect, low risk general public to get it before the spring. Unfortunately, I think all the news about the vaccines is giving people a false sense of security, so.
So I guess that is my staff report then.
All right.
Well done.
Well, thank you for your hard work. I'm extremely impressed. It's really difficult times, but
Thank you for saying thank you.
we keep on. All right. Well, I have nothing further. I will move to adjourn the meeting unless there are objections. Hearing none. Do I have a second to adjourn the meeting?
Second.
All right. And then we vote on ending the meeting. Alma, how do you vote?
End the meeting.
Ray, how do you
In
vote?
favor?
In
Jill, Mark.
In favor.
All right, everyone. Stay safe. Good night.
Happy
will-
Happy
Thanksgiving.
Thanksgiving.
Happy Thanksgiving to everybody.
Thanks.
You too.